So the next shoulder video is going to be the palpations. I have my list here just so I know what palpations to find. So starting with the bony palpations anteriorly, there's going to be the sternum. The jugular notch is going to be right there. The sternum is going to be right here. The clavicle, the acromion process is going to be at the end of it. It's going to be right there. The acromion, the acromion process right here. The AC joint is right here. Sorry about that. Coracoid process is going to be right below the AC joint, so it's going to be right about there. It should be, it's a little tender for her. The bicipital groove is going to be right there. It's going to be a little bit of a dent right there, right at the end of it. The lesser tuberosity is going to be on the inside of that. And the greater tuberosity is going to be on the outside of that. And then the humeral head is going to be right about there, right up there. The deltoid tuberosity is going to be a little bit of a dent right around here. That's where the deltoid goes into the arm, where it goes into its insertion point. Going towards, will you flip around for me? I'm going to the posterior bony palpations. The scapula is going to be the shoulder blade right there. The spine of the scapula is going to be the top part. It's going to be a little bit of a ridge right there. The superior angle is going to be right around there. It's going to be right there. The inferior angle is going to be right at the bottom, so it's going to be right there, right around there. The vertebral border is going to be the border that goes by her vertebrae, and then the axillar border is going to be on the outside. Going towards the soft tissue palpation, where you face around. Actually, I can do your posterior. We're going to do the posterior points here. So the upper traps are going to be right here. The posterior rotator cuff muscles are going to be right around there. The supraspinatus is there. The infraspinatus is there. Teres major, teres minor. The lat dorsi is going to be this whole part here going up, and the triceps brachii is going to be right there. And will you flip around for me? Herb's point is going to be right there. Yep, I got high at the dizzy. The axilla is going to be right there. The anterior joint capsule is going to be just the front of the shoulder joint. The subarachnoid bursa is, Hannah, you go like this. It's going to be right around there. You can only feel it if it's inflamed, but it's going to be right around that anterior joint capsule. The pec major is going to be going right around there. Biceps tendon is going to be right here. And then Hannah, will you go like this for me? And then I'm going to resist it. And that's the bicep tendon is going to be right there. The sit insertion point is going to be on the greater tuberosity. So it's going to be, where's your biceps groove? Right there. So it's going to be right around there. That's going to be the sit insertion point. And then the deltoids are going to be right around the side here.